5-minute Jumpstart Your Dreams now.
This is Louis from Syngular, and it's an honor to get to talk to you about what we do in our vision. And Syngular is a mixed reality technology company focusing on medical application, including surgical guidance, remote collaboration, simulation training. We are here to make surgery more accurate, to reduce error, and to make surgery safer. And we also want to, make the doctor travel less. So the pain point and problem in surgery is there are complex procedure. Even the most skilled surgeon can be overwhelmed in those difficult cases. And we also want to reduce the risk to the patient to avoid mistakes. And we have a growing healthcare expenses around the world. And the aging population is making all this even worse, and also overwhelm the workforce from healthcare. So there's a huge need to make surgeons to work in higher productivity and also to train them faster. So the current solution for surgical guidance is still quite outdated. Often they rely on 2D images, and surgeons still using manual measurements, and the providing very limited support to them. So right now is the right time to introduce new technology, because technology like mixed reality, AI, and robotic surgery, they are ready to make an impact. And along with a lot of smart hospital initiative around the world, I think our product quite well aligned with the industrial trend and also the clinical demand. So this is our solution, which include mixed reality surgical guidance system, which means if you look at the photo on your left, there is a real-time image overlay on top of the patient, which came from the CT or MRI. And our software elevate it to a new dimension so that it can be used inside the surgical room with a AR headset. So the doctor can use it for skin marking, for skin incision, bone cutting, deformity correction, etc. So all this can speed up the procedure and also make the surgery safer. At the same time, surgeon from different location or student can interact with the surgeon performing the surgery in immersive manner. So that will facilitate remote collaboration and also allow students to observe surgery much easier and also facilitate their learning. And the third one is, in order to scale up our business, we have built this AI-powered auto segmentation tools, which allow the doctor to build their own cases by themselves. So in the past, they have to send out patient images to external parties, let's say a 3D modeler, to turn those CT MRI scan into 3D model or MR environment, and which take days. Now with our AI system, we condense it into 1 hour. And our technology includes image processing technology, and also game design and game performance, including cinematic rendering, cinematic visualization, 3D tracking, low latency, and optimized interaction. And our early pattern involve mainly the image processing part, and we are now working on the 3D tracking and also multiplayer interaction in MR environment. So there are a few competitors in the field, and some of them focus on VR only in medical, and some in mixed reality. And they are still early, doing their A round. And in terms of competition, in the recent open tender from Hospital Authority, we won the bid. And even though HA, they tried the different MR product around the world. So we are confident that I think our advantage is our superior visualization and also responsiveness of our applications. So in terms of market size, it is quite significant, growing
Time is
into.
up. Thank you. Thank you so much. May we now invite questions from the judges? Thank you.
Hello, can you tell us more about yourself and the team? Thank you.
Yes. So myself, I have started a medical 3D printing company. So I'm very familiar with the surgical landscape in Hong Kong and around the world. And because of 3D printing, it is good, and also it has its limitation. And by working with surgeons every day, we know what mixed reality can cover, what 3D printing cannot do. So the advantage of mixed reality is the flexibility and also the cost effectiveness. When you 3D print a model, it is fixed. You cannot look inside. And also it takes time to print and prepare. But if you can do it in virtual way, it is much more flexible and also much faster to cover urgent cases.
Hi, this is Joseph from Brink. How much training does a surgeon need to be able to use this kind of software?
This is excellent question. If I do this 10 years earlier, it's not quite possible. But today, a lot of surgeons grew up playing video games, right? If we are facing a surgeon at their 30s, 40s, they pick it up within 5 minutes. It's video games, basically.
Who makes the purchase decisions and how do you reach them?
So how Hong Kong Hospital Authority works for emerging technologies, they have a team called Innovation Lab from the IT department, and they are constantly scouting different new technology vendor. And they spot us and then introduce us to, previous surgeons who raised the wish list, and then they did the matching. And then we did a lot of pilot project inside the hospital, and also we have to gone through all these security issue with the IT team. And finally, we are the first and only mixed reality supplier in the HA system.
So it'll be deployed in the hospital for trialing this year?
Yes, so right now, you can find it in Prince of Wales Hospital orthopedic department, and whenever they have new case, they load it to the AI system, generate the hologram, and put that to the AR glasses. So they all do it by themselves, and we are observing how active the server is.
What's the feedback from the surgeons so far?
It's really exciting to them because they always want to try this, but used to be the logistics is very difficult, right? Waiting for a few days and then, talking to vendors, how to, go through the surgeries. But now the doctor can do it all by themselves.
Probably I missed something. How is your appliance to be charged?
How is
Your service or your product, your
Be
appliance
charged.
to be charged?
Yes. So we are a subscription model. So we charge per user per yearly license. So right now, because the price is fixed for HA, now we have a model for them to follow, and then they can, based on this successful case, and then they will tell us how many more units they want to purchase.
Time is up. Thank you.